Health experts say Taiwan will see a peak in COVID infections next week, fueled by the BA.5 Omicron subvariant.
With the Mid-Autumn Festival around the corner, family cookouts and other barbecue gatherings could end up becoming a hotbed for infection. Some doctors say that taking rapid tests before meeting up for a group meal can minimize the risk of infection.
Others say that though Taiwan will see large daily infection tallies, the severity of the disease in most cases should be mild.
The Mid-Autumn Festival long weekend is just around the corner. It's a time when many people return to their hometowns. According to the Taiwan High Speed Rail, more than 376,000 tickets have been booked before and after the holiday. Health officials had originally predicted a peak in COVID infections next week, driven by the BA.5 subvariant. Experts offer advice on how to minimize the risk of infection during the break.
You might not know the people you're having a meal with well. You don't know how their health has been recently. You just don't know. If you spend 3 or 4 hours together chatting and eating, that puts you at a higher risk. It's best if you, first of all, have meals with people you know well. And second of all, with people who are aware of their health condition. It's even better if they have done a rapid test recently.
Doctors say people with symptoms should do a rapid test before having a barbecue with friends. They remind travelers that a previous COVID infection does not make the body immune to the disease. A doctor on Sunday took to social media to raise awareness about reinfection risks. He says that up to 25 out of 100 people who get infected by the BA.5 subvariant may have previously been infected with COVID. And even next-gen vaccines offer just 70% to 80% immunity against BA.5, meaning getting the shot does not reduce the risk of infection to zero. Taipei Veterans General Hospital Vice Superintendent Li Weiqiang says the bulk of infections in the upcoming BA.5 wave will be adults who socialize and are in contact with other people for work.
Although there will be a lot of infections and the infection rate will be very high, the infections won't be very severe. It'll mostly be mild.
Another doctor says that although the coming wave will result in many infections, most patients will experience just mild symptoms. He says vaccines are still a great way to reduce the severity of COVID infections.